as I think Mike said, we perceive the going forward course here to be very technical and very implementation. And I'd like to talk about those within some very specific issues. So if you think about the lack of capacity, we all know that right now we don't have capacity in our communities to serve the mental health and substance abuse needs of this community. Where's that capacity going to come from? Is it going to come from the community-based nonprofit world? Is it going to come from public counties? My best example is Bain Capital just bought up the methadone maintenance clinics in 6 New England states, New Jersey and Pennsylvania. Is it going to come from private equity? Okay, Bain Capital, Mitch Romney's company, right? Romney Care. No, this is not Romney Care, folks. It's a business opportunity. Okay, a large private equity firm just bought 80% of the stock of the largest correctional health care provider in California. Okay, this is a process that is going on. CCS and Geo Group just combined. The Geo Group Mental Health Services just became part of CCS. Corizon just brought in a new CEO, Woody Myers, who was a public health director, right? That the environment is changing, and the environment is changing because this question of who will provide these services to which folks now have an entitlement is now on the table. And this is all, we are exactly 3 months and 3 days into healthcare reform, and this is already happening. So one of the crucial questions is that, who will serve them? The other question, I think, will be, what will be available? Paul Samuels mentioned that in New York State, there's a mandate that court-ordered services be provided under the insurance program. That's actually the opposite of what exists in most other states, where insurance companies have gone to benefit exclusions that said that they get to exclude court-ordered services from coverage. Well, that's crazy if that's part of what we're doing now. If a service is medically necessary, why does it matter whether it's court-ordered or not? Okay? But this whole question is now, again, a very specific implementation question. Okay? Who will define medical necessity? How will it be defined? Will it be defined by the plans? Will it be defined by states? How will this whole issue of what will be available be there? The IMD exception, which was articulately referred to by Elena, probably the biggest need for justice-involved individuals is going to involve residential recovery at some point. What is the IMD exclusion going to mean? How is that going to handle? That parity is the rule, but the question is going to be operational. I think the other thing we don't know is what this will cost. Paul mentioned the work that's been going on in New York State. There was some analysis done. This is not justice involved. These are just folks with mental health and substance abuse needs where they've gone back and they've looked at claims data on what those individuals are spending in claims, and we're talking about $1,800 per member per month is what some of those severe folks are costing in claims. So are we willing as a society to make such a large investment in stabilizing the health, safety, and social systems that we rely on? I would take it even further and see we don't even know if we are prepared to understand the price we are going to pay for decades of neglecting this population, that in keeping this population hidden, we are going to pay a price into the future that we do not know what that is. So as we can see, these are not small, or insignificant issues that remain before us as we figure out how to go beyond the 3 months and 3 days into an implementation of a vision we articulated in this very room over 3.5 years ago. For us at COCHS, our goal has been to articulate a new policy frame by addressing the needs of jail-involved individuals within the mainstream health system. Can I say those words again? Within the mainstream health system. So that correctional medicine, correctional health as we've known it, becomes part and parcel of the mainstream health system. In doing that, the disenfranchised, at least in some fashion, become enfranchised. This goes back to the question that I answered to Matt earlier this morning when he said, well, what does it mean, this issue of Medicaid paying for hospitalization? And what I said is it means I bring quality assurance, utilization review, and prior approval. Those are tools of enfranchisement. Those are tools that we use within our healthcare system to make sure that everyone is treated equally and that human rights and equal rights are values that we all share. Making all of this happen will require commitment and hard work, not only by all of you in this room, but by many others who are not in this room. In the 3.5 years, we have made tremendous progress. And we at COCHS are incredibly proud, and I want to shout out again to Nan, to my staff in the back, Ben Butler, Mike, Dr. Keith Barton, David Horowitz, Matt Bekele, Julia Kaiser, Dan Mistak, for all of us for making this possible. The silos that had kept us apart and we have in some micro fashion in this room in bringing you all together, we have crossed those silos and brought them together. And we've done a tremendous job of recognizing the opportunity the Affordable Care Act has given us. Health reform is upon us. $7.1 million people enrolled in coverage through the exchanges, approximately another 1 million folks enrolled in the same risk pools through the individual market. As Marsha Regenstein told us, a significant number of those are going to have involvement with the justice system. A new phase of this work is upon us to ensure that healthcare policy and planning, that efforts in state and local jurisdictions, that public safety and correction systems naturally consider each other as their partners, and that we follow through on this vision we have created. And thanks to the good work of the panelists on the stage, the authors, and you and the audience today, this work can still evolve. Philanthropy seeded this market. You've all heard us thank philanthropy several times. We are here today because philanthropy seeded this market to ensure that the criminal justice population was included in healthcare policy considerations. This did not happen out of thin air. To make this vulnerable, high-risk, high-cost segment of our society visible. Those of us in this room need to continue to ensure that this population retains that right and that access of their newly found entitlement. COCHS has been very gratified to work with you for the past few years. And in particular, we want to extend our gratitude to the Robert Wood Johnson Foundation for its core support that began 9 years ago when Nancy and I first made our trip to Hampton County, Massachusetts. We wouldn't be here, and I don't think this issue would have progressed without the support of the foundation, and especially Nancy's support, COCHS' board support, COCHS' advisory committee support, our staff support, and most of all, from you. But like all good things must come to an end, the Foundation's core support of COCHS, which has carried us forward for these 9 years, is likely to end within a short time. So the questions I ask you are, how do we carry this forward? How do we continue to operate across all of our silos to ensure that the opportunities created by healthcare reform are leveraged to their maximum extent? And how do we ensure that the policy changes, many of which you just heard me recite, how do we assure that everyone gets a seat at Mike's lunch counter and that we don't have to wait the 4 years before we take that vision and turn it into reality? That's a lot to think about. That's a lot to ask you about. On that note, I want to thank you all again for being here. I want to remind you to fill out your evaluations, as Nan encourages me to do. I want to tell you that within the next week, this conference, which was webcast live today, to over 100 attendees. Okay, remember, folks, we had 225 seats. We had 281 of you registered for this meeting, and we had another 100 folks watching on the webcast because this is such a topic. This will be available in the webcast for those of you to share with your colleagues sometime next week. Thank you, Paul Seltzer and Spark Digital, for making that happen. And thank you once again, all of you, and safe travels. Thank you very much.